Hi, everyone. My name is Dr. Rebecca Seagraves. I'm the CEO of the Pelvic Health Network, and we have a special interview that I'll be conducting with special guests. I have Dr. Naomi Bauer that will be joining with me later, and a special guest appearance with Dr. Croghan, who will be sharing her experience with long COVID. There's a lot of uncertainty and just overall many questions that people have about long COVID, and also just the overall impact on a specific population that I've spoken about many, many times in terms of the impact just on their physiology from pregnancy, immediate and long-term impact on their body after being pregnant and after having a baby. And so we'll be speaking specifically about the maternal population and the impact of long COVID on just the role of being a mother. And so I would be so honored to invite Dr. Croghan up to the stage with me to share your experience with this disease and just the unknowns. Thank you so much for being here, Anne.
Yeah, of course. It's very nice to meet everybody. And I'm also a pelvic health PT and I specialize in obstetrics as well. And so I work with the maternal population. Um, so for my story, I was sick in 2020 and um, I tried really hard not to get sick, of course, but it still happens to us. And so when I was sick, it wasn't too terrible. I think the hardest part was I had had a baby about a year prior. I was still breastfeeding my child, and I have two older children. And they send you a letter talking about how you have to isolate from everybody, and to think that a mother can just isolate from her children is pretty extreme. I refused to isolate from my 1-year-old. I just had confidence in breastfeeding and knew that they would be okay. And then my long COVID, my illness was fine. My long COVID started about a month after, which a lot of people who have long COVID also talk about. Um, Started with like a rapid heart rate. And then because I'm a PT, I checked my oxygen, and my oxygen was down into the 70s, sometimes into the 60s, which is terrifying when you know what those numbers really mean. Um, so I started oxygen right away, and I was on oxygen while I worked. I had to manage tanks. When I came home, I had a concentrator with a long hose, but that meant I still couldn't go really outside with my children. I'm a mother that likes to mother through play, and so I could not play with my children. I had to sit um, and be attached to a hose the whole time. And so I tried really hard to get help. I went many places. I went to a long haul clinic. I went to my primary, and the only thing I really got was that I was deconditioned and I should exercise. And that just did not ever feel quite right to me. To think that you can get deconditioned from being sick for like 4 or 5 days just seemed not accurate. And why on earth that would make your oxygen drop that low also did not fit for me. Um, but I was trying to be compliant. And so I did try exercising, and it just kept making me worse and worse and worse. And eventually, I could barely move without my oxygen dropping. So, so I eventually was in a wheelchair because I had learned a lot about pacing and watched a lot of YouTube videos about long COVID. There was one channel in particular where this gentleman from the UK interviewed many different people and different medical professionals about long COVID. And so I was pretty sure I had dysautonomia, not exactly POTS, but an orthostatic intolerance for sure. And so I started following more of those pacing guidelines. And that was actually when I started to feel like I was leveling out and not just getting worse. Um, I went through the pacing, and I actually also saw an article about blood clotting and microclots and long COVID. And so I followed that path for a while. Um, but again, I was just spent my time in a wheelchair and spent my time without my children. And I would come home from work because I had to work. I had no choice. And so at work, I was lucky I could sit in a stool because I did pelvic health, and at least there was that. And I would come home from work and not be able to really play with my children. So I find that to be probably the most heartbreaking part. And it always makes me think about all of the women and mothers too who have other chronic conditions, and just all the time that they miss with their children. And I think that is probably the saddest piece. My older kids especially, like they knew me as a mom who would go walking with them and hiking with them and biking with them and skiing with them. I taught all of them to ski, except for my 3-year-old, because at that time, he was 2. By the time I was more in the depths of my long COVID. So that was hard for me to not be there for that. Eventually, I find myself very lucky to have found my way out of it. So I was in a wheelchair and on oxygen for about 2 years. And then the last year up until this point has been actually just like recovering a conditioned status, because after 2 years of being in a wheelchair, then you're deconditioned. I would accept that. And now I'm working my way out of that. So perseverance and luck is kind of how I got my way out of it. Figuring out the blood clotting was really important. I gave up on the long haul COVID clinic since it just kept making me worse, and their only offering was an antidepressant because I was obviously depressed, and that was why I was the way that I was. So I gave up on them and turned to my local physicians. And since I work at the hospital, they already knew me as a PT, and they knew that I was not just depressed and that there was something actually wrong with me. And mind you, I still had my oxygen going into the upper 60s, lower 70s, and I don't see how you can call somebody depressed and not address that piece of it. That is just neglect. But my physicians here, my local physicians, are the ones that really saved my life. My neurologist is the one who worked with me on the dysautonomia piece. And I started a treatment. I did like a steroid treatment and an IVIG treatment that was really helpful. And then I got really sick and almost didn't make it. And I ended up in the hospital here. And again, they saved my life at my local hospital. And I started an antiviral treatment for why ever I was sick. They're not quite sure why I was really sick, but my immune system was not okay.
And when was that?
Yeah, that was August of last year, so August of 2022. And like that was the first night in the hospital. It was the first night I had been without my children. And my immune system was so bad that they were like, your kids, we're not so sure they can come visit you. And so after I walked out of the hospital, after I was there for a few days, I felt so much better. And that's why I say I think luck for whatever treatment I got when I was in the hospital helped pull me out of my long COVID. And I still have some neurological damage, like in my quad, so I have to be really careful on how hard I push myself. But I am very lucky to be back with my children. And so now I can play with them. You just can't keep mothers away from their children.
Mm-hmm.
That's not good for anybody. And that is the piece that, like, if I never get better from where I'm at least I can play with my children now, and at least I'm not just sitting on a bench watching them from a distance, and that's really important to me. So so that pacing piece was really incredibly important until I was able to pull myself out of the long COVID. And I don't think that I didn't get that recommendation from a physician. I got that from YouTube. So
YouTube. Wow. There's just an incredible, and she's our guest speaker today, but she has just an incredible Instagram channel, and it's actually called All About That Pace. And so, I mean, I think that, I mean, this is just a perfect segue into inviting her, but I want to first just acknowledge and just your story is incredibly impactful on me and really underlies why the title of our interview today is Long COVID and Maternal Health. I'm not a mom, but it was incredible, impactful for me as a physical therapist to treat moms in the hospital and see them separated from their children, in 2020. And when our hospital just had the wherewithal to say, no, we can keep babies in the room, moms to me seem to get better faster. And that again, I don't have the research and the lit review that I've done on this. I can just say just maybe it was me from a clinical standpoint. I feel like moms got better faster. They had more um, of a desire to live and to get through it. And so it to me was very impactful to see a system that felt that separating the mom from her baby was better for maternal health and for COVID. And so it was hard, I think, just from that standpoint, but it's harder to now hear that that was your experience and you fought through it and you fought to see your children.
Yeah, I mean, I think, Rebecca, when we were in the depths of the pandemic, they would show videos on TV about um, long-term care facilities and the people within the facility and like their family on the other side of the window, right? And how sad that was. And we totally forgot about moms because like that's what they were doing with their children. Like, it's not okay. That's not okay. And like we totally missed that. Like we made it such a big deal for the older population, which is so fine and great. I'm not taking away from that. But like mothers were having to do that with their babies. Like that's not okay.
Right,
And mothers were doing that with their older children too. Like they might be older, but that's not okay.
right,
And yeah, you're right. We totally forgot about that piece. Like this population didn't get any help at all. They didn't get any help.
right. I like to have Dr. Naomi Bauer just join us for this segment. Dr. Naomi Bauer is a doctor of physical therapy, board certified specialist in cardiopulmonary physical therapy, and also specializes specifically in long COVID and POTS. And Dr. Bauer, thank you so much for joining us. And you're joining us from Scotland, I understand.
Yes,
Yes.
that's
Excellent. And so just hearing Anne's story, especially about the pacing, um, just from a clinical perspective, because I hear this, oh, you're probably depressed, you need to exercise more, build up your endurance. I'm just hearing like all of those things that I would never want to tell someone who would actually benefit from instructions and guidance on pacing. Can you give us just a little bit of perspective from a clinical side on pacing and why it's so important with this illness?
yeah. So without going into too much of the physiology and nuts and bolts of it, essentially for a lot of people who have long COVID, they have a problem with their ability to produce energy. And so their body isn't able to produce enough energy to meet the demands of the activities that they're performing. For some people, that may be higher level activities like exercise and work, but for a lot of people, those are your activities of daily living. So getting dressed, fixing meals, taking care of yourself. Depending on the degree to which your energy system is impacted, you may not be able to produce enough energy to complete those tasks on any given day. And so the reason why pacing is so important and so effective is that it is a tool to help you structure your life and your activities in a way that allows you to allocate the energy that you do have to the things that you need to do so that you can complete the activities you need to do. And there are a lot of different pacing strategies out there. There's stop, rest, pace. There's the energy envelope theory. There's the spoon theory. There's the 4 Ps of pacing. We don't need to get into all of those different ways of pacing, but for pacing in general, it's how do I take the limited supply of energy that I have and allocate it to the activities that I need to do, along with appropriate rest breaks and energy conservation techniques to allow me to complete my activities. And then as you start to implement that and you get better at pacing and knowing where your own boundaries are, that allows you to stop overspending your energy. Because when you overspend your energy, that's what causes you to have these big flare-ups and symptoms. And like Anne was mentioning, being in bed for days on end, not able to do a lot. When you can figure out where those limits are and use pacing to stay within those limits, that allows you to actually have some space to start to recover and heal and start to do more again, because you're not continually overspending your energy.
That completely makes sense to me. And described that she's a mother who's engaged in active play. That's how she mothers. She mothers through play. And so I mean, I have to ask, like, you can't speak for the long haul COVID clinic, but why do you think they would have given any recommendations other than pacing?
So I know, and you got COVID fairly early on in the pandemic, and a lot of healthcare providers did not understand the pathophysiology behind long COVID early on in the pandemic. And so a lot of people, PTs included, unfortunately still to this day, a lot of people don't understand that pushing through and exercise training are harmful to people who have long COVID. And so to give the long COVID clinic the benefit of the doubt, they may just not have been well enough informed to realize that what they were recommending was harmful at that time. I don't think there's any excuse for that for people who get told that now, because we have so much more information and so much more awareness around it now. But the idea that the standard recommendations around exercise training and activity progression and just pushing through some minor symptoms because they'll get better, that's the mindset that healthcare and fitness professionals and PTs included have had for so long that it's really hard to come to the other side and recognize that those treatments are actually harmful for people with long COVID. Unfortunately, it's something that I have heard a lot and had a lot of people experience, being told to exercise and being told, you know, if your symptoms get a little bit worse, just keep going and it'll get better. Mm-hmm. But that is probably why Anne got those instructions to just kind of push through and exercise and keep trying. The pacing, a lot of people knew about pacing, but I don't think that it would be considered mainstream knowledge early in the pandemic. I think now it's a lot more understood and there's a lot more awareness, but certainly for like the first year of the pandemic, it was not on most people's radars that pacing was the right thing to do.
And would you say that more people now are familiar with pacing, even just people maybe you've been connected with who also have the illness, or even moms in general? And I have to preface this saying that the very physiology of being pregnant and then the uncertainty of how long that postpartum period really is on someone, we really struggle with knowing that in the first 12 months, a mom is still at risk for cardiomyopathy, peripartum cardiomyopathy. And so to not take away from long COVID, I think it's a general overall misunderstanding about pacing in general, like how really it applies to so many diagnoses, but to especially long COVID. Do you feel like there has been a shift in the recommendations that you're seeing, Anne, from your perspective?
I think there's definitely a greater awareness, like Naomi said. I'm not sure. Since I don't live in the city, I'm not so sure about where the long haul COVID clinics are going with that. I will say for the people that we see in our clinic with long COVID, we tend to offer more assistive devices. And I don't know too if that's just because of my experience, since my rehab family witnessed me go through that. And I know that at first they all thought I was giving up when I would bring a wheelchair in. And when I would just use my wheelchair to go around the clinic, because even just walking from my room to the front desk was too much. And I think that so that with the pacing piece was a good understanding for me, that even just those few steps done multiple times a day could be too much for somebody. But yeah, so I'm not sure. I don't know if Naomi has a different experience, but at my clinic, I'm in a rural community, and everybody witnessed me go through that and then get better. And I think then they realized I wasn't giving up. And so we tend to offer more assistive devices. But
Naomi, I mean, just to comment on what Anne just said, I'm having a little trouble with that, description. And I think it goes back to our episodic care model. We as physical therapists want people to get better. And if we see them going in a direction that we're not expecting, like having a wheelchair, having one day where you're using an assisted device and it doesn't it doesn't seem to be on this trajectory of where you're gaining more function and you're losing, that support. I think we kind of get into a state of, well, there must be something else, or you're still dealing with that, maybe those questions that patients or people just in general have to kind of deal with, even from family or friends or just people who don't know, or other healthcare providers who are just not informed of this illness. So I'm kind of like having, just a bit of a challenge just hearing Anne's experience just in a rehab setting, about people's awareness of this illness. Do you have anything to add to that?
So to pick up on what you're saying about this episodic model of care, which is really what most rehab providers are used to, and honestly, most medical providers in general, you are used to having a patient come in for a specific problem, you treat that problem and it gets better for the most part. Obviously, there are exceptions like in primary care. But I think one of the things that has made long COVID so hard, and I've seen this even before COVID with the individuals I worked with who had postural orthostatic tachycardia syndrome, long before long COVID was a thing. The rehab world in particular is not set up to manage ongoing chronic illness that needs ongoing support. And for people who have long COVID and other similar conditions like ME/CFS and POTS and chronic fatigue, that whole realm of conditions where there is no cure, it typically is not something that goes away. It's all about learning how to manage. If we go through an episode of care and we haven't figured out how to fix it, we don't really know what to do. And unfortunately, even for people who kind of understand that it's not an episodic illness like a sprained ankle, which you're going to heal from, the whole healthcare system is not set up to handle chronic illness like that. People who have long COVID need ongoing support. They need to learn tools for management. They need to have access to healthcare providers to help when they have flare-ups. And so it doesn't work well with a typical episodic care model that we have. And I mean, like Anne was saying, a lot of people aren't used to seeing somebody using assistive devices as a tool rather than as, I don't want to say giving up, but like, I think as a society, we see people using assistive devices as they're getting worse or they're declining. And instead of seeing them as this is a tool that allows you to continue living your life. And some days you may need it and some days you may not. And that changes day to day. But yeah, I think just generally our care model is not set up well to support chronic illness, because people unfortunately don't just get better from stuff like long COVID. And sounds like you've had a very fortunate set of events that have meant that you have been able to have this significant improvement in the last year. Unfortunately, that's not everybody's experience. And there are many people who do not have a significant improvement even years later. And so for them, it's all about learning how to maximize what they have to live the best life that they can. And I think that women and mothers in particular really struggle with that because of the expectations that are placed on us and the roles that we have in society make it a lot more challenging to prioritize ourselves and our own needs, whether that is prioritizing family time or prioritizing rest time and pacing, or both together. It is much harder to do the things that you need to do for yourself if you're also having to care for others, whether it's something that you really want to be doing or not. So, I mean, like Anne said, caring for her children, engaging with her children, playing with your children, those were things that were very important to you, are very important to you. But in order for you to heal and be able to not continually be wiped out, you had to learn how to modify how you did that so that you could still spend time with your children in a meaningful way. I don't know if that fully answered your question or if I kind of went off on a bit of a tangent there, Rebecca.
No, not at all. I mean, Anne to me is the epitome of the person that we really should be having wraparound care for. Motherhood is not 6 to 8 weeks, 2 times a week, right? Motherhood is 24/7. And she just opened her story, even describing that she was able to teach her children to ski and now her little one. I mean, that's kind of is uncertain in terms of, the changes that her body is going to go through and just keeping up with her young one, as he grows and wants to become more active. And so to me, the care model needs to really wrap around a population that requires a continuum of care, because there's just so much in terms of changing and evolving. I mean, and what if you now knowing what you know, what would an ideal care model be or have been to set you up for a better experience?
That's a really good question. I mean, I think like mental health needs to be a part of it. And I even think that, which I did participate in on my own accord. But I even think just share, like I was talking to a friend about this interview and how I felt like it was probably going to bring up a lot and I was probably going to need to go back to therapy, which is fine, of course. So I think that really needs to be a part of it. Nutrition is a huge piece. We need more nutritional guidance. And maybe just, I mean, other than having people with the knowledge of the updated research, I think that my biggest frustration would be I know how to read and understand medical journal articles. And so I would bring an article that I found to the long COVID clinic, and they had not read it, which is also, I get it, there's a lot of research to go through. But that they hadn't read and hadn't seen it. And then also response was, well, we can't really test for that, so we'll just keep doing what we're doing. So I think like a care model that can adapt and change would be probably more important. And I don't know how you even begin to do that, but I find it crazy that one of the only reasons why I got better was because I learned about pacing from a YouTube channel. I mean, and obviously this is YouTube, but that's crazy. We tell patients not to, don't Google your condition, right? But what if that's all you have?
And you're so right. I mean, and honestly, because Naomi's so humble, we have a history of doing a residency together at Duke. And she went off and did a lot of amazing work in cardiopulmonary, cardiovascular and pulmonary care. But I had to learn more about what she was doing as a health coach from Instagram. And I was just blown away, by some of the things. I would just sit and just watch and listen to her speak, but then actually be walking and demonstrating to people what pacing looks like. And I was just like, first of all, I know her. And second of all, this is where healthcare, this is where the care model should be. And it doesn't fit in an episodic care model. And I don't know how to necessarily bring that into the academic setting to prepare students to think 360, nutrition, mental health, actual, recommendations that really are prescriptive in terms of what a person is feeling at that time and being able to change with them and not be so regiment. And so with Naomi, with your background now, what you have done in your career, now where you are, what are you seeing as a care model that would potentially help someone with long COVID or who's struggling with POTS, dysautonomia, just all of these things that we have so little information on?
Yeah, so that's a little bit of a loaded question, because I think that we can train students, we can train new clinicians, we can set up people to provide care in a way that would be better. But the problem is that the insurance systems are not going to support that, which I think is one of the biggest barriers. So to give a little bit of sort of perspective here, at the start of COVID, I was working in an outpatient clinic, and I was already working with individuals with POTS at that time and was starting to see some of the barriers that we now see with a lot of individuals with long COVID. In particular, the barrier of actually accessing care, because there aren't very many clinicians who are well informed about POTS and now long COVID. But in addition to that, the physical capabilities of these individuals to get to appointments can be quite limited. And I can't tell you how many times I had patients who would come in and they would come into their PT session already exhausted just from getting to PT. And so participating in PT was not really helpful because they were just overspending their energy literally to get there. What I do now is fully virtual health coaching for POTS and long COVID. And for this particular population, that care model in a lot of ways is better because they don't have to physically get to a clinic. They don't have to find somebody in their geographic location to go to. And so I think that an ideal care model, particularly for these sorts of populations, would include a lot more virtual access, the ability to see doctors or physicians and PTs and OTs and all the other healthcare providers that this patient may need to see, having the ability to communicate with them and have appointments with them virtually, have a way to access testing that doesn't necessarily require going to some big hospital system. I mean, Rebecca, you know how it was at Duke. You could have to walk 20 minutes from the parking deck just to get to your lab appointment. That's completely inaccessible for so many people. And so I think a care model where there is that much virtual support would make a big difference for a lot of these individuals. But outside of that, in terms of preparing clinicians, obviously we need to include conditions like this in our education. I never once heard of postural orthostatic tachycardia syndrome in school. I didn't learn about it until I got to residency. And then honestly, it was just luck that I happened to do a residency in a clinic where they were treating it. There are so many people who have the same qualifications as me on paper who've never heard of POTS. And so I think that we need to have that education in our schools for PT and all other healthcare professionals. But I think we also need to improve education on listening to patients. And I don't just mean sitting and hearing them. I mean like actually listening to them, believing what they're telling you, and using that to guide your interventions. Because there are so many people who will go to providers and they will say, I told them all these things and they didn't believe me. Or they said, oh, that's not my area of expertise. I can't help you. Or we don't have a test for that. Like Anne said, we don't have a test for that. So there's nothing we can do. And that reaction or response rather to a patient bringing you concerns like this is detrimental. Like it doesn't matter if you don't have a test for it, you still need to believe what the person is telling you. You can say, we don't have a test for that, so I can't, based on a test result, treat you, but we're going to do the best that we can with the knowledge that we have. It's okay for a provider to say, I don't know, but it needs to be followed with, but I'm still going to do the best that I can for you.
That's so true. I mean, and you were basically recommended antidepressants, and that was the underlying cause of what you were experiencing, is what you said. Is that right?
Yep.
Yeah. And I just to bring my perspective in this whole thing, what I got scared the most working with moms in the hospital were the moms who had to come back to the NICU because they were not given a wheelchair to just wheel themselves, and there was no transport services. The transport services were for patients in the hospital, not for moms coming back to see their babies in the NICU, even though themselves, they had been discharged either after COVID or either after, some kind of cardio or a respiratory illness during pregnancy and immediately after birth. And so I'm just thinking of just the complete care model, even the immediate aftercare model needs to completely change. But then in terms of just this population, moms are so active. And so the fact that Anne was able to get such amazing life-saving information through YouTube, the care model has to include virtual care. It has to. And I mean, you and I both work with people in person, but I just don't see how you would have gotten where you are now had you not found that information online.
No, I think I actually think about this a lot because I don't know if I'd be alive, to be honest. So that it was huge. And right. And if I didn't have the resources to do that also, because it's not everybody has access to the internet. Yeah, it saved my life. So that's a really big piece, the virtual piece. Mm-hmm.
So Naomi, where do we go from here in terms of even what you're doing in terms of coaching? Do you see that over the long run that the coaching model or the virtual care model really is probably the most sustainable for people with long COVID, especially for moms?
I think that for individuals with long COVID and especially for moms, the virtual model, I think, is what's going to allow the best access and the highest quality of care to individuals, because the clinicians who have the knowledge to really treat long COVID, and even more specifically mothers with long COVID, there's not very many of them nationwide, worldwide. And so if physical, like in-person care is the only option, there are a lot of people who are just never going to get care. Now, that being said, there are definitely things that need to be in person. Like if somebody has something that is really medically unstable that needs in-person monitoring, or various tests that need to be done in person, those you have to do those in person. But when it comes to the rehabilitation side and learning the lifestyle modifications like pacing and energy conservation, and knowing if and when it's appropriate to start exercising again and how to monitor yourself with that, between the internet and smartphones and all of the devices that we have now, all that stuff can be done safely and effectively in a virtual model. And I think that for this particular population, I see that as the most effective form of rehabilitation at this point. Because, I mean, regardless of long COVID, moms are busy. Like, how easy is it really to get to PT twice a week if you're a mom? Versus if you could have a virtual model that's primarily asynchronous, so you do it on your own time. You're not having to get to an appointment, spending time and energy driving there. So I think that the virtual model has a lot of benefits in that regard for long COVID and for mothers, but especially for the crossover, to maximize the time and energy that you have for your family and not spend it unnecessarily on physically getting yourself to and from appointments.
You're right. You just like turned on a light bulb. There are ways for you as a long COVID health coach to monitor Anne's activity, is there not?
Yeah, there's a zillion different wearables out there, so I'm not going to go into it in detail, but we have smartwatches that can monitor heart rate. Some of them monitor oxygen saturation, though I will put the caveat in there that most of those are not validated, so I wouldn't use that. If you are having trouble with your oxygen, I would get a finger probe. But yeah, we have all kinds of different devices that can monitor. Some of them can provide almost real-time continuous data back to a clinician. Some of them may require the patient, the individual, to send that data to them. So for instance, with the clients that I work with, they will check their vital signs and they will input it into a form that goes into a spreadsheet for me, and I can see all of their vital sign trends. I can put it in a graph. I can see how they're doing. And so there's a lot of ways that we can do remote monitoring now, and there are new devices coming on the market probably every single day that are going to make monitoring better. I just yesterday read an article about a little thing that they're developing that goes in your ear that monitors blood flow to your brain and can predict when you're going to pass out. And they're thinking it's going to be helpful for individuals who pass out, individuals with brain fog, all sorts of different things. And it's just like a little thing that sits in your ear right there.
That's incredible. For moms that are watching this, for anyone who's watching this, and what take-home message would you like to give them, just in terms of just from your experience, hope that you have? What would it be?
Yeah, I have two things. So to answer your question, I think for moms listening to this, it's okay to like create spaces in your world where you have a place that you can sit down and at least watch your kids play and watch them be children. Even if it's really difficult to access their play because of where they are, at least get out of bed and sit and watch them, because they'll circle back to you and involve you because they can see you and they'll remember you being there. And so try to create those spaces for yourself. And then also don't give up, because it is a rough spot to be in. And as you learn to manage your symptoms and pace and go through all of that, it does actually get better. That does help. It's not a cure, like Naomi said, but it helps tremendously and will help you find your out. I think sometimes when I first started, I just kept digging a hole, and people would ask me why I was digging. But I just kept digging because that's what I'm doing. I'm trying to dig my way out. And it wasn't until I started pacing, was able to get out of that fog and clear my head, because when you're not pacing, the brain fog is real. And when I was able to clear my head, I thought, why am I digging? That makes no sense. And why are all these people just standing around asking me why I'm digging? Why is nobody offering to help me out? And that was when I kind of just decided I have to stop relying right now on all these other people who are not helpful, and find the people that are helpful that existed in an online platform, so that they could offer me some like footholds so that I could pull my way out as opposed to dig my way out. And I think once I really figured that out is what was really helpful. And again, like I found that in an online platform of YouTube, and also my local physician here, because she knew me, was like, okay, Anne, this is not okay. We need to figure this out. And so finding a champion for yourself is really important, because this is the other piece I wanted to bring in with what Naomi was saying. Hearing Naomi speak, I just wish I would have had her, because when you're really sick, you can't control your health care. Like, I needed somebody to be my leader, because I couldn't be my own leader. And I'm used to being leaders with patients. And I remember just feeling really disappointed that like I didn't have myself to help me. And I wish I would have had somebody like Naomi to give me guidance and help me track all of these things and tell me why they were good or why they were bad, as opposed to like my only alternative was every night I would write everything down in a journal so that I could keep track of what was actually happening to me and what was going on. It's just, that's not efficient. I needed a person to help me. And so for moms, it would be really important to find a person like Naomi that will help you to keep track of that, so that you don't have to do it all on your own. And you can just have people to help you get out of the hole and not dig anymore.
Thank you, Anne. Naomi, you have an Instagram channel. It's all about that pace, like the most appropriately named place where people could go to for information. Where else, what else would you point people to? You know, where else could they go? What other information would you want moms, people listening to this interview to know?
Yeah, so my Instagram is definitely a good way to get in touch with me. And I do post a lot of informational and educational content on there. One organization that I have recommended to a lot of people, which I think has a lot of very good resources, is Long COVID Physio. And that may, Anne, actually be the group that you found. They have a website, they have an Instagram, they have Facebook, pretty much all the things. But their website has a very well laid out set of resources. That they have little educational videos too that are designed to be understood by non-healthcare providers. So they're set up to be understood by the general population. And they have videos on pacing, they have videos on energy conservation, they have videos on shortness of breath, or orthostatic intolerance, which is increased symptoms when you're standing up. So I would definitely say that that is a great resource for long COVID generally. But as far as kind of other things, the best thing that you can do, like Anne was saying, is find somebody who can be that advocate for you and support you. I've told a number of people this before. The best healthcare providers are the ones who listen, not necessarily the ones who are the experts. So find it only needs to be one person. Find that provider who will listen to you, and then they can help get you where you need to go, advocate for you. They're the one, if you can find somebody who's really listening to you, they're going to go out and find answers for you if they don't know the answers. And that is going to be your best support, not necessarily going to the experts in the long COVID clinics or seeking out specialists. Yes, you need some of that stuff for certain things, but the person you really need in your corner is that one provider who's going to advocate for you and support you and direct and guide you, because having long COVID is exhausting. Being a mother can be exhausting. And when you add the two together, you don't have the energy to advocate for your healthcare also.
Thank you both. And I want to just even thank and hug your primary care physician, who I believe the Naomi was describing, the person in your corner, not necessarily the expert. I think that we have now like elevated, our specialists, even in our field of physical therapy, such to the point where we are forgetting that the primary care physician, the primary care PT, the general PT, those are the ones who are likely listening and then finding who to send us to. So I thank you so much for sharing your story, Anne. And Naomi, long COVID physio is the resource, and Anne, that's the group that you most likely found. So long COVID physio, and they have a lot more public facing content that people can understand and go to. And then it's all about that pace is your Instagram, where people can connect with you.
Yep.
Thank you both. Really. Thank you so much for your time.
You're welcome.
Thank you, Rebecca, for setting it up.